Hello, my name is Benjamin Mickelsen, and I'll be presenting on the effects of pulmonary rehabilitation following an acute exacerbation of COPD on vascular health. For some background context, chronic obstructive pulmonary disease is a progressive multifactorial disease that primarily affects the lungs and airways. It has now been shown that COPD patients also experience elevated vascular dysfunction and cardiovascular risk. Additionally, COPD patients often exhibit extreme levels of physical inactivity and can transiently experience acute exacerbations, whereby COPD symptoms as well as risk for cardiovascular events are potentiated. Pulmonary rehabilitation is prescribed to COPD patients to slow the progression of the disease through supervised exercise training, education, and behavior change tactics to support healthy living. It is thought that pulmonary rehabilitation may have a positive effect on vascular health. Vascular health will be defined as an umbrella term for both vascular function and structure. The purpose of this study is to determine whether pulmonary rehabilitation improves vascular health following an acute exacerbation of COPD. Methodology. Initial measurements, including a pulmonary function test and vascular outcomes, were obtained for each participant within 2 weeks of a hospital discharge. 25 acutely exacerbated patients completed the 8-week pulmonary rehabilitation program, while 16 individuals acted as acutely exacerbated controls. Both groups would be considered on average to be severe COPD. 8 weeks later, both groups returned for post-data collection. Flow-mediated dilation, or FMD, was measured on the brachial artery. A greater percent increase in dilation is indicative of better vascular function. Pulse wave velocity was calculated between the carotid and radial arteries. A slower pulse wave velocity is indicative of less stiff arteries and healthier vascular structure. Preliminary results. These two figures depict the group means and standard deviations of vascular outcomes from pre to post. Pre-measures are in blue and post are red. There were no statistically significant differences between groups for both FMD or pulse wave velocity before the intervention. Following the 8-week period, we saw no significant change in FMD percent increase. However, if you look to the far right side of the slide here, the control group showed a significant increase in their pulse wave velocity, indicating stiffer arteries and poorer vascular health. This brings into question whether or not a similar increase in the pulse wave velocity of the intervention group would be observed had they not participated in pulmonary rehabilitation. It is possible that pulmonary rehabilitation may serve as a protective method to prevent vascular stiffening following an acute exacerbation of COPD, although future research should be conducted to strengthen this claim. Thank you.